I'm going to be doing the cover and uncover test to test her for strabismus. Could you cover your right eye for me? Okay, uncover it. Okay. Cover your left eye for me. Look straight ahead. Uncover it. Okay. No strabismus is noted. Next, we are going to do the ear exam. I'm going to look at her ears bilaterally, noting any lesions. I don't see any exudate. Now I'm going to test for her hearing, and I'm going to do the whisper test. I'm going to stand on each side of her and whisper 3 different, turn this way. 3 different words on each side, and she'll have to repeat them back to me.
Dog, cat, mouse.
Good. I'm going to go to the other side and do the same thing.
Cheese, house, dog.
Correct. Next, I'm going to use my tuning fork and do the Weber test. And I'm going to strike the tuning fork and put it midline on her scalp, and she should be hearing it equally on both sides. Do you hear it equally on both sides?
Yes.
Okay, good. Next, I'm going to be doing the Rhine test on each ear and counting how many seconds it takes her for it to stop hearing it. It should be normal is bone conduction is twice as long as air conduction. I'm placing on the mastoid bone, and just tell me when you stop hearing it.
Okay.
Okay. Now tell me when you stop hearing it.
Okay.
Perfect. Now I'm going to do it on the other side.
Okay.
Now we're going to do air conduction.
Okay.
Perfect. Normal results. So by these tests, we can tell that cranial nerve 8 is intact. Next, I'm going to be looking with my otoscope in each of her ears. I'm going to be looking for her tympanic membrane and making sure that it's pearly gray and translucent. I'm going to be pulling up and back on her pinning. Okay, I can see her tympanic membrane. It is pearly gray and translucent. There is no bulging, no signs of perforation. There is no excessive earwax in the canal. Now I'm going to assess her left one. I can visualize her eardrum. It is pearly gray and translucent. No evidence of bulging or perforation. There is no excessive earwax in her canal. And there's no redness as well. Next, I'm going to assess my patient's nose. Her nose is midline. I also don't notice any visual problems with her septum. I'm going to occlude each nostril and have her breathe in. Breathe out. And next one, breathe in. Breathe out. Her nasal airway seems to be patent and equal on both sides. I'm then going to look inside her nose. No sign of rhinorrhea. Her terminates are pink and moist. Next, I'm going to test her cranial nerve 1, her olfactory nerve. Can you tell me what you smell?
Alcohol.
Correct. So her cranial nerve 1 is intact. Next, I'm going to be assessing my patient's mouth. I'm looking at her lips. They don't appear cracked or dry. They look supple. They don't have any lesions or marks on them. Then I'm going to, if she looks well hydrated, I'm going to have you open your mouth for me. Can you open your mouth? Stick up your tongue a little bit. I can see that she has 28 teeth. Her teeth are white. I don't notice any foul odor coming from her mouth. Her uvula is midline. Say ah for me. And it rises when she says ah, which is normal. Her tonsils are +1. No signs of swelling or redness. Her palate is intact, hard and soft. And her pharynx is pink and moist. Can you stick out your tongue for me? Good. I'm going to look at the underneath of her tongue. Good. Can you stick out your tongue for me and move it side to side? Good. Next, I'm going to test your gag reflex.
Ugh.
Her gag reflex is intact. So with this assessment, we can see that cranial nerves 9, 10, and 12 are intact. Next, I'm going to assess my patient's neck. Her neck is symmetrical. There are no lesions. Her trachea is midline. Now I'm going to assess her thyroid. Can you swallow for me? Her thyroid is smooth. No signs or feelings of masses or goiter. I'm going to now assess her lymph nodes. I'm going to be assessing her periauricle, postauricle, occipital, tonsillar, submandibular, superficial cervical, posterior cervical, her supraclavicular, and her axillary nodes. Sorry. Okay. I did not feel any lymph nodes. Next, I'm going to assess my patient's neck, a carotid pulse. Carotid pulses on both sides. Okay. They're good, and they're +2s. Can you tilt your head to this side? I'm going to assess for any jugular vein distension. No jugular vein distension noted. Next, I'm going to be using the bell of my stethoscope and assess the patient for any carotid bruits. No bruits heard. Next, I'm going to check her range of motion in her neck. Can you press her head against my hand? Good. Here, back, forward. Good. And can you shrug your shoulders for me? Good. Her cranial nerve 11 is intact. Next, I'm going to assess her upper extremities. Feeling her arms. Her muscle tone is good. Her nails look well manicured. And there's no signs of clubbing or, and her capillary refill is quick. And her nail beds are pink. I'm going to assess her brachial artery. Good. And her radial arteries. Good. Good pulses. +2 and equal. I'm going to now assess your back. So I'm just going to turn the chair this way so I can take a look at your back. Her back is symmetrical. Keep breathing. And it's even when she breathes. I don't notice any moles or nevi on her back. Anytime you're doing a physical assessment on your patient, you should always be noting their skin. See if they have any irregular moles or asymmetrical moles, and use the ABCDE acronym for that. Her skin's good and clear. I'm going to palpate the spine. Ask her if she feels any tenderness.
No.
Okay. I'm gonna check for tactile fremitus. Can you say 99 for me?
99. 99. 99. 99.
Good. No tactile fremitus felt. I'm also going to test her to see if she has any flank pain. Does that hurt?
No.
No flank pain noted, which would be a sign of pyelonephritis or kidney infection. Her spinal curvature is straight. Next, I'm going to measure her diaphragmatic excursion. I'm going to have her take a deep breath and hold it. I'm going to percuss up to down and make a mark. And then I'm going to go from down to up and make a mark. Can you take a deep breath in and hold it for me? Okay, I'm going to make a mark here. Take a deep breath and hold it for me. Good. Make a mark here. And on the other side, I'm going to do the same thing. Take a deep breath and hold it. Good. And again. Good. And you can breathe regularly. So when I measure it with my ruler, it's 4 centimeters on both sides, which is normal. Next, I'm going to be listening to her breath sounds. You can take a breath in. Breathe. Breathe. Good. Breathe. Good. So no